Over the past couple of decades, I think Indian pharmaceutical products have established themselves in the Philippines for their quality and affordability. And this has brought down costs for Filipinos, especially those with chronic ailments. And I think this is something that we would like to see continue. And one of the things that in this context is going to be very important is for the Philippines to have a quick regulatory approval process. This has been flagged by many Indian companies as an issue wherein they're not able to bring some of the latest medications on the generic side to the Philippines. So that's something that we definitely like to work upon. We've been discussing an MOU between the FDA and its Indian counterpart, and we hope that that MOU will provide us a platform whereby we can also assist the FDA in building up its capacity to examine dossiers faster and to come up with its decision making. One of the lessons that came through the pandemic was that the regulatory bodies need to move very quickly. Sometimes public health requires that you move quickly. That's why when I said that if there is a political priority, which seems to be there, to try and expedite the approval process to enable that more affordable medicines come in. Sometimes these approvals can take years, and oftentimes the companies then get a little discouraged when bringing in new medications because the process can be quite tedious. So I think partly it's a matter of putting the right priority on expediting it. Secondly, obviously there could be other interests that are not keen on having expedited approvals. So obviously there is a balance between what is commercially valuable for various other companies that are acting here and what the government needs to do in terms of expanding accessibility and affordability for the population. And across the spectrum of healthcare, which includes diagnostics, for example, medical devices, but also treatments like dialysis. One of the Indian companies here, a company called NephroPlus, which started only 2 years ago, has seen a very dramatic increase in its demand. So it's already set up 24 dialysis centers, and it's got plans to set up quite a few more. So this is an area, I think, where, again, Indian presence in the Philippines can help to bring down costs and make sure that the Filipino community at large can benefit. So I think one of the elements that I see clearly in the administration of President Marcos is a desire, and the first time I met him, he articulated this interest in learning from India's experience in healthcare, and exactly along the lines that you're saying. So I think the way in which we want to do this is to keep the private sector, which is the key actor, front and center, and also to try and create enabling public policy frameworks that support the engagement between our two private sectors. This is an age where technology is becoming a big factor. Technology can be a positive disruptor in terms of pricing. For instance, just a couple of weeks ago, or maybe about 10 days ago, we had a launch of a Indian developed diagnostic screening tool for breast cancer, which is based on artificial intelligence. And this is a non-invasive and very, very, shall we say, no radiation is involved. So it's a very safe and non-invasive method. And this, for instance, brings down the cost of routine examination from about 2,500 to 3,000 pesos to about 300 or 250 pesos. So this is the kind of transformation that we would like to introduce to the Philippines, because in India, definitely price is a very, very important factor for healthcare services. And the entire effort on the part of the government and on the part of the companies is to try and make healthcare more affordable. So this is precisely the kind of technological disruption that we would like to bring into the Philippines from India. And this, I'm happy to say, has been already introduced in the Philippines. And as part of the medical seminar that we did, the conference that we did along with Business Day last year, we did feel that this was an area where Indian healthcare, health tech startups can really contribute. And I think there's a very thriving innovation ecosystem developing in the Philippines. And our effort has been to try and somehow link up both the innovators and the startups, but also the established medical service providers in the Philippines, and get them to look at India and to see what's happening in the Indian market. And that would, to my mind, be a dramatically significant factor in bringing down costs. The same way that generics brought down prices in the late 80s and the 90s, I think that health tech can bring down the cost of healthcare in the 2020s and beyond.